Hi everybody, my name is Logan Kovac. Um, my project for the Population Health Project is called Clean Hands, Healthy Lives, a Hand Hygiene Guide. The basic premise of my project is regarding hand hygiene, education, proper technique displayed in my chosen population. So why should you wash your hands? So washing your hands or any sort of hand hygiene for the cleansing has been around from 3 to 400 BC. It originally started just to rid the skin of soilage. One of the biggest breakthroughs that we've ever had with hand washing was the introduction of detergent usage, and then as well as on top of that was applying friction with that. And over the years, there's been so many research studies, so many quantitative, qualitative articles that talk about the effectiveness of each technique, and it seems like we've pretty much came down to one system, and it seems to have a great reduction in bacteria. Of course, it's the number one way to break the chain of infection by stopping it at transmission. Another big reason for those who work in healthcare is the fact that whenever you decrease the risk of infection, you can also decrease the amount of nosocomial infections, which your patients and management would very much appreciate. So my population I chose was the South Ridge Church. It's a little church in Fairmont, West Virginia. Basically, I chose it because that's where I go to church, and I always see people that talk about health literacy and talk about healthcare and talk about everything as a whole. Plus, it's a very crowded community as well, and there are a lot of people that come in even whenever they're sick. So I kind of wanted to be able to help the population break the chain of infection and also help them protect themselves for the most part. Because a lot of people do not know proper hand hygiene or when to use what or the correct proceedings or um, the steps and which step goes when. So before I get more into my project, I want to talk more about like my windshield assessment findings. To sum this up, I basically observed from service hours on Sundays anywhere from like 8 to 12, 8 to 11 as well. The population seemed to be middle to upper class. The church, it's a very clean area. A lot of people go to it. It's held in very high standard in the community. Um, there are two main healthcare facilities in the area, and they are less than 10 minutes away. There is a college as well, the one that we are currently attending, and then there is also a technical college, Pierpont, which is also very close as well. Police and fire departments aren't very far as well, and they're also in good standard. A lot of people feel safe in this area. There's a lot of people as well in this population that are from like different designations, different cultural backgrounds, different religious backgrounds, because the church itself is a non-denominational church. I was able to identify the main problem for my project in this area and in my population specifically would be the poor health education. Even though mid to high socioeconomic class, they will admit to knowing proper infection prevention, hygiene, for especially hand hygiene. But upon demonstration, they weren't really allowed to correlate between what they were saying and what they were showing. So I would recommend interventions based mainly off of education on how to do it, why it's important, the risks, and then show them how to do it as well and make sure that they demonstrate correct and proper technique. The big strength that ended up coming from the community was the togetherness as a whole. Everybody is friends with each other. Everybody's family with each other. Nobody lets anyone go through anything alone. Um, and I'm kind of comparing this against the church that I used to go to back home, which is very similar health literacy wise, but poverty levels and then social class, they're a little bit different. A couple goals that I ended up basing off of my windshield assessment would be to increase the education of hand hygiene, the use of alcohol-based sanitational methods. Um, I want them to be able to display a decreased infection rate and have a better compliance with hand washing and any kind of infection prevention. Um, I wanted 100% of the people that I had to be a part of this project to be able to demonstrate correct hand washing procedures by the end of the term. I did meet some goals, but one thing that you'll see later in this PowerPoint is it's not as much as you would expect. And my last goal, especially the one that talks about on this slide, would be having people self-screen and identify personal risk factors for transmission. Materials that I used were verbal instruction, um, basically on all of the educational information as well as the sanitational locations. Um, I also have this PowerPoint, which I also showed my sample. And then I also have a literacy friendly instructions that are mainly images that we put on the back of the service guide. And I have a picture of that in the slideshow as well, um, because there was a amount of people in the sample, even though the sample was small, that actually could not read or write. During a service, I asked basically who would be a part of my project, and who would be willing to verbalize about hand washing, hand hygiene. And out of 82, I ended up having 20 people that agreed to take part in the project. This is a little bit of a background on these people in the sample. I ended up asking them their education levels, if they knew how to wash their hands correctly, if they knew like the most up-to-date information, if they knew where all like the hand hygiene stations were, and if they could perform it for me. And out of all of this, 14 of them had college or had some college. The rest had a high school diploma or equivalent GED. Two individuals in this study were illiterate, so that really threw a wrench into my plans on information presentation. So that was why a lot of it ended up being verbal and illustration based. Around 15 people told me that they knew how to properly perform hand hygiene. There were 5 that were honest and said that they just didn't know. There was 2 that were able to tell me where all the alcohol-based sanitational areas were. The rest did not, and honestly, at this point, I did not as well. And only one person in this sample was able to show me correct hand hygiene. After getting all that information, I ended up educating the sample on hand washing, the basic premise, the whole point of washing your hands, how it reduces the amount of bacteria and can also reduce other things like fungi, pathogens, and other microorganisms as well. I had to educate myself first on where all the hand hygiene stations were, and that was part of the plan. I also wanted to demonstrate proper technique for them. That way, whenever I did go to reevaluate, they wouldn't have to be just looking at like a piece of paper or anything like that and guessing. And I wanted to find a tip sheet, which is the item that's on the back of the service guide, that was mainly images or just illustrations and would be better for people that didn't read and write very well. I took all of this planning and base them into interventions as well. Intervention was so I put a hand washing guide on the back of the service guide as well with the religious leadership's permission. I also demonstrate a proper hand washing technique and with a teach back method. I explained all the risks, all the improper hand hygiene. I ended up finding all the hand washing stations and I instructed them on that. I educated them when it's proper to complete hand washing others on other than substitutions such as alcohol-based solutions. The big thing is if your hands are usually visibly soiled, that's a number one sign that you need to wash your hands over the alcohol-based sanitational methods, but there's other indications as well. A little bit of numbers for you. Upon my evaluation, I took all 20 of them and I compared and contrasted it back to my goals and my interventions and my planning. And at the end of it, 100%, everybody was able to localize a tip sheet, which is a big thing. Um, Everyone was also able to show proper hand washing and hand hygiene techniques. Um, Pretty close to 90%, but 85% were able to identify where the hand hygiene stations are. And then 75% were able to explain to me the risks of improper hand hygiene. And this seemed to be an issue more than anything. I ended up reviewing the risks before, in the middle, and after. And if anyone had any other questions, I would talk to the person, review individually. But I was kind of shocked to see that it was only 75% at the end of it. The feedback mainly was good. They were just happy with the fact that they were updated on infection prevention guidelines. This actually ended up sparking more questions about infection prevention. And we ended up talking a little bit more about PPE, other different things. Um, and I was kind of happy to see that my community actually had questions instead of just kind of blowing it off. And they wanted more information after we were done about alcohol-based sanitational practices, because if you ever look at alcohol-based solutions, it says that it kills 99.9% of germs. That's true in most situations. A lot of bacteria are susceptible to the bactericidal effects of alcohol-based solutions. But whenever you have specialized bacteria, fungus, spores, things like C. diff, C. diff, alcohol doesn't kill it. Bleach can kill it, but they don't recommend to put bleach on your skins. The best way to remove those spores and the other bacteria is just hand washing. Changes to be made. Like with for there to be an increase into the community-wide health education. The religious leaders and I were talking, and they said that they would kind of keep an annual review, state of mind, when it comes to hand hygiene and infection prevention. And if anything does change, they would said that they would print out like a QR code to the website for like the CDC or another health accredited agency or organization. Um, Increasing the amount of hand hygiene stations because at the time there was only two other than the sinks and the bathrooms and kitchen areas. And then I would like for the alcohol-based sanitational uh, dispensers to be placed in more of the common areas. They are kind of more in the like daycare area and more towards the front door for one. But there should be an increase in spacing them apart the common area because the more you see them, the more likely you are to use them. A lot of what I pulled from these articles were common knowledge for the most part, but there were a few different things, especially with the hand hygiene and informational statistics and stuff like that, which I did not know, which I used to apply to see what was the most appropriate for my population. And these are just a few things that the literature supported more than anything. Of course, hand hygiene is the number one way to create a reduction in bacteria and break the chain of infection. Usually preferred over alcohol-based sanitational methods, especially when the hands are soiled or after having any kind of patient or being in that 3 foot intimate zone. Um, Friction is been proven with along with detergents to be key when scrubbing the hands to get the most amount of bacteria off. And most people don't know proper hand hygiene, and they really don't know why it's important, which is something that I feel like needs to be stressed, because a lot of people, if I feel like if they knew why we're doing what we're doing, they'd be more applicable to learning. And just breaking the chain of infection as a whole. This is the image that we ended up putting on the back of the service guide, basically saying to wet your hands, put on soap, scrub for 20 seconds, rinse them off, dry with a paper towel, and then to take the paper towel, shut the faucet off. And this is just a reference page. Thank you guys very much.